This is a virus that has a disproportionately negative impact on folks who are older, who are vulnerable, who have an underlying medical condition. And so with that in mind, we issued restrictions on access to nursing facilities and assisted living facilities. But because we had the 11 cases, we now have 11 cases in Broward County. I'm directing Jared Moskowitz to expand the current order and prohibit all visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes in Broward County for the next 30 days. Beyond that order, I've directed the Secretary of our Agency for Healthcare Administration, Secretary Mayhew, to aggressively and continuously connect with all these facilities throughout the state, in person, by phone, whatever you need to do to ensure that they're following appropriate protocols and have a plan in place should they have an individual that tests positive. So far, Secretary Mayhew and her team have visited over 260 facilities in person. So we appreciate with that. As I said yesterday, we're committed to expanding testing capabilities in the state of Florida. We all know that there was CDC tests and everything. I wanted to make sure Florida was acting quickly on its own to do this. So I directed Director Moskowitz to purchase 2,500 testing kits that will give qualified labs throughout the state the capacity to process tests for up to 625,000 individuals. Each kit allows 500 tests, but you need 2 tests per person. So you're looking at 250 individuals per kit. Up to that amount, obviously, the tests have to be done properly. And I've also directed our Surgeon General, Scott Rivkees, to strategically distribute these testing kits to 50 CLIA-certified labs throughout the state, starting with hospitals so that testing can be completed closer to the patient. A lot of the hospitals have concerns if people are in the hospitals, then it takes 48 hours to get a test result back. If they have a lab that can do this, they're going to be able to do it there without having to send the sample everywhere. That would mean they would probably get the results back quicker. So far, we've received 1,000 of the 2,500 of the kits we've ordered. Now, this is a display. So they're not actually in there. They're being refrigerated, or they have to be kept at a certain temperature. So we do have 1,000 kits now, and I'm directing Dr. Rivkees and Director Moskowitz to distribute all of these 1,000 test kits that are here to laboratories and hospitals that request and can use them as soon as possible. The tests will be distributed with priority to hospitals in counties with the highest need, starting with Broward County, based on their increased number of cases. And so to give you a sense of where the state is in terms of testing capability, none of the folks referred for tests have not been able to get a test. We've had capacity to meet the folks who have been referred up to this point. Right now, the Department of Health at the 3 labs operating in Tampa, Jacksonville, and Miami can do a combined 300 patients per day of samples. We also have the capacity to do another 100 tests per day with a CLIA-certified labs throughout the state. The goal is to have 50 of these CLIA-certified labs throughout the state, processing about 100 per day. So that would be a good increase in our capacity should that be necessary. You also have the private sector that is stepping up efforts, Quest and LabCorp. Now, they don't actually take the samples for the test, but they process the test and come up with results. And so those are collected, shipped out every night. They test all through the night, and they're trying to get the results back within a 24-hour period. I think by the end of next week, both companies are going to be doing about 20,000 samples a day nationwide. Now, obviously, Florida will be a part of that. And so that is something that will be beneficial as well. I want to stress, if you're somebody who is experiencing symptoms of COVID-19, fever, cough, shortness of breath, and you speak to a physician and they think that you should be tested for it, then we have opportunities to do that via the Department of Health, via your doctor, via some of the hospitals. So get it done if you need to. The CDC initially, when this came out weeks ago, had linked it to different travel in certain countries. And obviously, if you've done that, that's still something that could be very significant. All the cases in Florida, the overwhelming are all still linked to international travel. Some of the other investigations are ongoing. So that is, but you don't have to have traveled. If you have the symptoms and a doctor recommends it, then you can receive a test. And we want folks to be doing that if they're experiencing the symptoms. I'm also directing Dr. Rivkees to set up voluntary and targeting sentinel testing of additional individuals so that we have better data on COVID-19's impact, particularly among mildly symptomatic populations. I mean, these test results that are coming in are great. We put out the numbers. You know, it's, I hope, helpful for folks to see that. But there are certainly people out there in our state and throughout the country who have very mild symptoms, who may have a cough for a few days, and they're not even thinking about calling a physician or getting a test. They're just kind of going about their life. And fortunately, with this virus, for the vast majority of people, that's probably going to be the type of symptoms that they get. But we want to try to figure out if we could identify, you know, how much more prevalent it is amongst some of these populations which are not exhibiting very significant symptoms. Again, those are going to be younger populations and healthier populations. But I think this is a good effort to, as this thing goes more, I mean, we knew we were going to have more cases this week. There's going to be more cases next week. I mean, that's what's happening. I think some of the social distancing that's being done with reducing the gatherings, some of the other things that have been implemented in nursing homes, I think that's all important. I think that'll help. But just from the contacts based on the cases so far, you know, you're anticipating more. So we want to make sure we have the increased testing capacity, and we didn't want to wait for anyone else to do it. Incidentally, when we spoke to the manufacturer of the test kits, they told us Florida's purchased more than not only any other state, but all the other states combined. So I really appreciate Director Moskowitz getting on that issue and getting these things out. I'm also announcing today that we will be, in probably over the next 24 hours, activating certain components of the Florida National Guard to assist in our efforts to support our local communities that are affected by COVID-19. We're working on the shape and scope of that. You know, if you mobilize a physician who's actually working on this now in their community, probably not the right thing to take them out of that fight. So we're going to look to see where are the folks located now who could offer help. And it's not just physicians. You know, they have nurses, they have medics, they have a lot of other people who really could help us. And we think that if we have National Guard support, that they could help augment medical staff shortages, potentially could help expand testing resources, and even potentially setting up a field medical clinics if that were needed to be the case. So it's been, if you look at the last few days, you have sporting events canceled, all this stuff. You know, I think that it's something that is, people are erring on the side of caution in the private sector, government organizations, and I understand that and think that that makes a lot of sense in many respects. But I also think that this is something that we'll be able to get through. You know, we're going to have to do this for the foreseeable future, but it's something I think that the people of Florida will be able to get through. So I know it's frustrating to see an event canceled or to see some of the inconveniences, but I think that everyone wants to, up and down the state, the local officials I talked to, the medical professionals, the private businesses, they want a healthy environment in Florida, and so we want to do our best to make sure that this virus is not allowed to simply run unchecked throughout our society. If you want more information, our website is floridahealth.gov. It's got the updated guidance on COVID-19.